Hello, Dallas. Today we're answering your ultimate FAQs about colonoscopies. First up, is a colonoscopy painful? Usually, patients are sedated, so they don't feel pain. However, if sedation isn't used, patients may experience mild to severe pain. Next, is it worth having a colonoscopy? Absolutely. It's the most accurate method to detect polyps and abnormal tissues in the colon, helping prevent colon cancer. It's recommended for those aged 45 and above or those with a family history of colon cancer. What can be diagnosed during a colonoscopy? It's used to search for polyps or abnormal tissues in the colon. It can also diagnose causes of unexplained diarrhea, abdominal pain, rectal bleeding, changes in bowel movements, or blood in the stool. How long do you stay in the hospital after a colonoscopy? Typically, you'll need to stay for 1 to 2 hours to allow the anesthetic to wear off and for monitoring before you go home. Are you asleep during a colonoscopy? You'll likely be given an anesthetic to make you comfortable and pain-free. Depending on your doctor's discretion, you may be given a general anesthetic to sleep or a local anesthetic to remain conscious but pain-free. Why was my colonoscopy so painful? Pain during colonoscopy is often due to the insertion of the endoscope. Thinner and more flexible endoscopes may cause less stretching of the mesentery, which is the major cause of the pain. Can a person die during a colonoscopy? Colonoscopy is generally a safe procedure. However, very rare cases of deaths have been recorded due to intestinal perforations during the procedure. The overall mortality rate of colonoscopy is 0.02%. What foods cause polyps in the colon? Foods that promote inflammation may increase your risk. These include high-fat foods, red meat, and processed meat. How long will I poop after colonoscopy prep? After taking the prep, it usually takes 2 to 3 hours before you start to poop. You'll have frequent bowel movements to clear out your colon before the procedure. Do you get colonoscopy results immediately? If no polyps or abnormal tissues were found, your doctor will tell you straight away. If polyps were found and removed, they'll be tested in a lab with results available in 2 to 3 weeks. How do you drink colonoscopy prep without vomiting? To make it easier, you can add flavorings, drink it cold, use a straw, or suck on a lemon or candy after drinking. Who should not get a colonoscopy? It's generally recommended for people aged 50 to 75. If you don't have a family history of colon cancer and you're not in this age range, you don't necessarily need a colonoscopy. What is the recovery period like after a colonoscopy? After the procedure, you'll need to stay in the hospital for 1 to 2 hours.